Over the last few months, many of the hospitals in the far-flung administrative regions were supplied with GeneXpert machines to efficiently test for COVID-19. The Lenghty Hospital was the latest to access the machine in February of this year. GeneXpert machines were also deployed to the Mabaruma Regional Hospital, Burima-Waini Region 1, the Linden Hospital Complex in the Upper Demerara Berbice Region 10, and the New Amsterdam Hospital in the East Berbice Quarantine Region 6. This effort eliminated the need for health personnel from these regions to send patient samples to Georgetown to be tested for COVID-19, which in the past had resulted in a longer turnaround time for results. The machines, according to Health Minister Dr. Frank Anthony, can churn out results within an hour. This newscast, having noticed that on several occasions in May, COVID-19 fatalities were reported by the Ministry of Health several days after the deaths occurred, sought to inquire from the minister as to the reason for the delay. The minister's attention was drawn to the most recent instance where the deaths of two females, a 36-year-old from Region 4 and a 71-year-old from Region 10, who succumbed on May 26th and 27th respectively, were reported until June 4th. According to the ministry's report, the patients were admitted with COVID-19 symptoms but died while receiving care at the medical institutions. Samples were reportedly taken at the time of admission, which subsequently returned positive tests. To further clarify, Dr. Anthony noted that it sometimes takes time for samples to be processed to confirm someone has died from COVID-19.
We do have persons who would pass away, let's say in one of the regions. When those deaths are made known to us, if the person would have displayed symptoms or signs of COVID, then a swab is taken, and that swab has to be processed.
According to him, while a person might succumb on a particular date, the confirmation of what caused their demise might be delayed until a PCR COVID-19 test is conducted. In most cases, reports of COVID-19 fatalities are made by the ministry one day after the patients are confirmed to have died from the disease. Apart from the GeneXpert machines, the National Reference Laboratory was also supplied with two automated PCR testing machines in December of last year. The new machines were intended to reduce the turnaround time for results to as little as 2 to 3 hours. On an average, over 1,000 COVID-19 tests across the 10 regions are conducted on a daily basis. Meanwhile, 100,000 first doses of the Russian Sputnik vaccines were added to the country's arsenal on Monday. Dr. Anthony informed that second doses of the vaccine, which are currently in demand, have been paid for and are expected to arrive later this month. An additional 100,000 doses of the Chinese Sinopharm vaccines are also expected. They were ordered at a cost of approximately $15 per dose by government. As of Monday, more than 212,541 persons have accessed the first dose of the vaccine, whilst 77,980 have been fully vaccinated. Relative to the ongoing flood situation in several regions, Dr. Anthony divulged that health teams are constantly monitoring those affected for possible outbreaks of waterborne diseases. To date, none has been reported.
Through the regional system, we have skin ointments or ointments for rashes and so forth. We have been distributing that to various communities. We have also been giving out bleach so that people can use that to purify their water supply. And we have been on the lookout for diarrheal diseases.
Temika Rodney reporting for the HGP Nightly News.